If you're a dental office and you're struggling with case acceptance and getting people to move forward with the treatment you've recommended, I can help you. At my office, we do over $2 million in revenue, working 6 to 7 hours a day and taking 8 to 10 weeks off a year by using key strategies to help people move forward and get to yes. The problem that I feel as a dentist, and what I see most of my dental colleagues feeling, is that when we talk about the word sales, we oftentimes feel sleazy or grimy, or that we're trying to convince something to somebody. I'm here to tell you that by reframing your mindset around sales and actually refining your process, you are going to help more people move forward with what they want and actually help them live healthier lives along the way. As a dental healthcare provider, you have to think about sales as getting people healthier, not making more money or convincing people of things that they don't need. So let me tell you about my process that I use to communicate with patients and help recommend treatment in a way that leads to a very high case acceptance rate. The first step is actually listening to the patient. Now, what I mean by this is not sitting there just listening to them talk about their cat that has liver disease or all these things. These are important processes to get to know them and build rapport, but asking them the question, what is it about your oral health that affects your life the most right now? What is it that brought you in here today? What are you hoping that we can accomplish? People will oftentimes tell you exactly what it is if you just ask the right question and you listen well. When you ask this question, they'll often say things like, I have never been confident in my smile and I hate smiling. Or I would love to sink my teeth into a prime rib and feel all the sensations in my mouth when I'm eating it, but I can't because I'm missing some teeth. Or I had the hardest time cleaning around my teeth and I always have bad breath because my teeth are so crowded. Whatever it is, you have to listen to it and remember it. That is going to be the first key step in getting high case acceptance rate, as I'll tie it back into in our last step in recommending treatment. The second step in getting high case acceptance is affirming the patient that they've made the right choice in coming to see you. After you performed your exam and you have treatment ready to recommend to them, you simply need to tell them, hey, based on your goal of fill in the blank, I want to let you know that you are in the right place and I can help you with this problem. By affirming they made the right choice, you're going to remove buyer's remorse and make them feel confident that whatever you're recommending is going to be the best thing for them. The next step in achieving high case acceptance is to present treatment simply. Don't overdo it. In other videos, we talked about developing stories and analogies. Present the treatment simply, use an analogy to make it easy for them to understand, and then leave it open-ended. After you've recommended it, just ask them, what are your thoughts? And you'll be amazed when you leave it open-ended what people will tell you, and it oftentimes brings up their core objection if they have any at all. So lastly, let's talk about how to combat common objections that you receive when you recommend treatment. In other videos, I've encouraged you to write down the most common objections that you have in your dental office. And what you'll find is it usually boils down to a few key concepts. Once you know what these key concepts are, you can come up with abilities to combat these and help people still move forward to get what they really want in the first place, which they've stated in their original, this is why I'm here, this is my goal, this is my pain point. So let me give you an example of how in our office we combat one of the most common objections that comes up when treatment's recommended. That common objection is, I need to think about it. Almost all of us have had a patient who said this before. This is how I combat that common objection. I totally understand. This is a big decision. I understand it's an investment, and me recommending it to you might have been something that you weren't expecting. I would love to give you time to think about it. What I want to do is I don't want you to fall through the cracks. I want to make sure that you're followed up with appropriately. We have set time on our schedules where we reserve for people that we need to follow up with, and we're not always available. So what I'd love to do is get you on the books so we can follow up with you at a time that feels appropriate to you. By doing this, you're creating value of your time because they now see that you're not always available for them to call at any hour of the day, as well as you actually have a specific time that you're going to follow up, showing that you care about them and you don't want them to fall through the cracks. After this happens and they get on the schedule to be followed up with, what we say is, hey, great, I'm so glad we got you scheduled. Just so that we can be prepared, what is it that you wanted to think about so that I can be prepared to give you any sort of solutions to help you move forward when we have this follow-up call? What that does is it's going to allow them to more than likely tell you their main concern. well, I really just need to look at my finances and see if I can afford to do this. Or I really just need to talk to my spouse and make sure that they are on board with this as well. Whatever that is, all of a sudden now you have the real core issue that you can help them overcome or help them get their questions answered so that they can get to yes and getting the treatment that they need and live healthier, fulfilling lives without having to break a tooth on a Thanksgiving morning. So my call to action to dentists who are looking to increase their case acceptance, increase revenue without having to invest in some really expensive piece of equipment is to think intentionally about how you listen to patients, how you recommend treatment, how you tie it back to what's most important to them emotionally, and then you reaffirm them that they have made the right choice and that you can help them. If you watched to the end and found value on how to increase case acceptance and increase your ability to communicate and help patients move forward, I would encourage you to stay tuned. We have videos coming out every week to help dentists increase their case acceptance, provide better value to their patients, and enjoy their work and life even more.